And in fact, in my clinic, I hear many stories about women who do or obliged to do some kind of sexual transaction for sugar, for oil, for charging your phone, and so on and so forth. So this is the situation where you tell yourself, what I'm going to do. You have to take care of those women, although you disagree completely on those young girls being pregnant or even being in the marriage in the first place. But at the same time, you have so much neglected areas in their reproductive life, prevention of violence, sexual health, the whole issue of rights and dignity in healthcare, because with such a big amount of refugees, the money that's coming to help them is the money restricted only to pregnancy, childbirth, and vaccination. And there is no attention to the other aspects of their lifestyle. So what we did from there, because this problem, I cannot stop it. This problem is not going to stop anyway. There is at least 25% in one of the studies we did, 25%. Fine. 25% during the study that we did among the refugees in Lebanon were married between the ages of 12 and 16. 25%. And 90% of all the adolescents who are either married or not married are willing to be married if they're not married and willing to have babies if they're married. Between 12 and 16. Because of the notion in their mind that we want to establish our identity in the society and we want to replace the lost kids during the war. What we did in brief is that we engaged the community of the refugees. We brought women who are passionate, who are like kind of leaders, young women. We engaged them in kind of training on delaying the pregnancy, on talking to these women, bringing them to school, to night shifts at school, and at the same time, for those who are pregnant and who are not showing the antenatal care, to go to them, to remind them of the importance of coming to the antenatal care or going there with some kind of education, with iron, with multivitamins, and so on and so forth. But this problem will continue to escalate. All what we can do is try to minimize the harm as much as we can in the face of this really grave problem.